Why is caregiver communication difficult in dementia care? Imagine trying to have a conversation with someone who is slowly losing the words and memories that help us connect. That's what caregivers face every day when caring for someone with dementia. The reason communication becomes so tricky is that dementia gradually damages key brain functions needed for understanding and expressing ourselves. As these skills decline, it becomes harder for the person with dementia to follow conversations, find the right words, or remember what was just said. This can lead to frustration for both the caregiver and the person they are caring for. One major reason is that dementia affects language and comprehension. People with dementia often struggle to find words or may use incorrect ones, making their speech confusing. They might repeat phrases or have trouble understanding spoken instructions. For example, someone with Alzheimer's disease might not understand what you are asking or might respond with unrelated words. This makes conversations feel disjointed and can leave caregivers unsure about what the person truly needs or feels. Memory loss is another big factor. When someone forgets recent conversations or loses track of what they were talking about, it interrupts the flow of communication. Attention problems also play a role, as they make it difficult for the person to stay focused on a conversation or follow instructions. Caregivers often need to repeat themselves or simplify their language to help the person stay engaged. Behavioral and emotional changes can also make communication more complex. Frustration, anxiety, or agitation may cause the person with dementia to act out or withdraw. Caregivers might find it hard to interpret these nonverbal cues, like facial expressions or gestures, which are often the only way to understand how someone is feeling. This can lead to misunderstandings and feelings of helplessness. Sensory impairments are common in older adults with dementia. Hearing and vision loss can make it even harder to communicate effectively. If a person cannot hear well or see clearly, they might miss important cues or become more isolated. Regular hearing and vision checks, along with aids like hearing aids or glasses, can help improve interactions. The environment also influences communication. Noisy, chaotic settings can overwhelm someone with dementia, making it difficult to focus on what's being said. Quiet, familiar surroundings help create a calmer space where conversations can flow more smoothly. Care settings that lack social stimulation can increase feelings of loneliness, making meaningful interactions even more challenging. Caregivers themselves face challenges. Many may not have training in dementia-specific communication techniques. Learning to speak slowly, use simple sentences, and incorporate nonverbal cues like eye contact or touch can make a big difference. Patience is key, as it often takes longer for someone with dementia to process and respond. Caregiver support and training programs are available to help develop these skills and improve the quality of care. Cultural and language differences can add another layer of difficulty. When caregivers and persons with dementia come from different backgrounds, understanding each other becomes more complex. Using culturally sensitive communication strategies and possibly involving interpreters or bilingual staff can help bridge these gaps. To improve communication, caregivers can try speaking in clear, simple language, maintaining a contact, and using facial expressions to show understanding. Giving the person extra time to respond, avoiding correction or confrontation, and using gestures, pictures, or touch can also help. Creating a calm environment with fewer distractions makes it easier for the person with dementia to focus. And seeking out training or support can boost caregivers' confidence and skills. Because dementia is a progressive condition, communication will continue to change over time. Caregivers need to be adaptable, patient, and understanding. Maintaining meaningful interactions is essential not just for meeting daily needs, but also for respecting the dignity and emotional well-being of the person with dementia. Remember, always consult healthcare professionals for personalized advice and support tailored to each individual's needs.